afternoon, everyone. I shall be discussing development of a predictive model for anatomical closure of macular hole with no financial disclosures.
Madam, please, you can introduce yourself.
Okay, sorry, sir. I am Dr. Kanwaljeet, Harjot, MADAN. I am working as a VR surgeon in Tendai Hospital, Jalandhar. Macular hole was first described by Knapp in 1869 and classified into 4 stages by Gas. And vitrectomy was first of all described by Kelly and Wendell for macular hole with success rate of 58%. The causes of macular hole could be idiopathic trauma, pathological myopia or VFT. 4 stages has been described by Gas. In stage 1, there is a yellow spot or ring formation. In stage 2, the small full thickness macular hole size is less than 400 microns. In stage 3 and 4, there is just difference of PVD. And surgical principles include removal of the vitreous, posterior hyaloid, ERM, ILM, and gas tamponade. We did a retrospective study in our center. We studied 107 eyes of 107 patients who underwent vitrectomy for macular hole. And surgical procedure was done in them with gas tamponade. And we recorded best corrected visual acuity, fundus photo, and OCT. OCT parameters measured were stage of the macular hole, height, base diameter, minimal diameter, macular hole index, diameter hole index, fractional hole index, and hole form factor. These are the various OCT parameters. And we observed that the mean age of the patient was 63.2 years. More females were there. There were 71 females, and the mean follow-up of the study was 9.2 months. And mostly patients, 71 patients, they had the grade 4 macular hole. And the visual acuity improved from 636 to 618 post-operatively. And 101 patients, they had the type 1 closure rate. And few complications were seen. From this study, we observed that if macular hole index is less than 0.3 or from 0.3 to 0.35, if we do the conventional procedure, the hole remains open. And if we do ILM flap, the hole was closed post-operatively. And if the MHI is less than, more than 0.35, even if we do the conventional procedure, the hole was closed. And in tractional hole index, we observed that if it is less than 0.6, and if we do conventional procedure, the hole remained open post-operatively. And in the hole form factor and diameter hole index, we didn't observe any relevant association. Even if we do ILM flap or conventional procedure, the hole was closed. So based on our results, we developed a very simple predictive model which indicates that tractional hole index and macular hole indices, they have strong correlation with surgical outcome. If MHI is less than 0.35 and THI is less than 0.6, they indicate poor anatomical closure and they need ILM flap. So based on this simple model, we did a small prospective study. Though it was a small number of patients, they were just 31. 4 patients, they had MHI less than 0.3, and 7 patients, they had THI less than 0.6. ILM flap was done in all the patients. And rest of the 20 patients, they underwent conventional surgery. So we observed type 1 closure in all the patients. So to conclude, ILM flap is a promising addition in the armamentarium of VR surgeon. And if macular hole index is less than 0.35 and tractional hole index is less than 0.6, patients need inverted flap procedure. Thank you.
In your study, in the prospective part of the study, it is just one side of the cases. The other people who have more index, you have not presented.
In the prospective study?
Yeah.
Yes, there was small number of patients based on that simple model. We just tried to see whether this study model is successful or not.
But you took only patients who had less than 0.35, not more than 0.35.
The rest of the 20 patients, they had more than, in which we did conventional procedure.
Okay.
Only 11 patients, they were there.
Fine.
But this model was instituted on a particular machine because the retrospective data is a huge data. So I don't think it was on the same machine, right? Could not be.
No, it was same machine.
It was
It
same
was
machine.
Octa.